All right, sir. What I'd like you to do is grab your steering wheel for me, please. Yeah, thank you. And I like how you're leaning forward there. I just need to position this behind you, just like so. All right, sir. You can sit back and lean against my device. All right, very good. And then I'm going to start the process by first just loosely buckling the buckles just to get this thing in place. So again, grab the steering wheel, sir, but you don't have to lean forward. All right, here comes one buckle. You can see that these are designed for multiple sizes of Americans. In this case, we can get rid of a lot of that slack, but I'm not tightening yet. I'm just positioning at this point. I'm noticing as well that there's some kind of color coding here. On some designs, they're very careful to do like a red, yellow, green, or stock yellow, go type of arrangement. But for this device, the main idea is that I'm going to position the device to stabilize the torso first. I'm going to do the legs second, and I'm going to do the head last. Pretty much the same idea as we were doing before. So when I'm looking at the torso, this device, hands on the steering wheel again, sir, has some handles here because eventually we're going to use this to haul the patient out of the car. And if I have a space between the top of the armpit and the device, this device is just going to go and slide up, and that's bad. I want to get all that sliding out of the way first. So I'm going to make sure that I've got these straps loose enough. Sit up a little bit for me, sir, that I can slide this device nice and high into the armpits, and I can hold it there by just giving it a manly twist, like so.
Manly twist.
Yeah. And now that I'm holding that manly twist, I can start to really tighten this down. And I like to hold this in place by tightening the bottom and the middle straps the most. And I leave the top one a little less tight, just because that's the one that's going to really inhibit the breathing. You can feel it's challenging you to breathe a little bit, right? Can you still take a deep breath? Okay.
He looks like he's zen.
If I was to tighten that red one quite firmly, which I might do right before the move, but I don't need it right now while I'm still positioning the device. I want the patient to be able to breathe comfortably. Meanwhile, down here, this bottom and middle, I'm going to crank on this a little bit. And the best way to do that is to push and pull at the same time. That's better. I mean, watch this. Did the spine jiggle? It did not jiggle. Some of you are going to go like this. All right, let's go ahead and that's not good. So just push and pull. All right? And I want this to be firm enough that it is going to start to give that corset effect, squeezing in all of that tissue to hold the spine in a nice column. You can still breathe though, sir. All right. Now it's time for those leg straps. Who's climbed in a harness before? Good, good, good. Do the straps go down here around the thigh, or are they uncomfortably close to the family jewels?
Family jewels.
Yeah, sadly so. And that's exactly what we're shooting for with this device as well. Some folks will go so far as to even cross the straps underneath the groin. We don't recommend crossing the straps, but it is important that you floss the straps. And here's how that ends. I reach back here in my patient's automobile. I find the appropriate strap, and I need to be careful to make sure that it's not twisted in any way. And if my patient can help a little bit, sir, grab your steering wheel again, and I want you to very gently lean to the left, and you can help us a little. That's all I need, thank you. And now I use a flossing motion to get that right into the middle.
You gotta pay for that in some places.
And before I buckle the strap, I pull it all the way forward so that there's no tension behind the butt cheek. That's very important. So pull the tension, bring that uncomfortably close to the family jewels, or whatever the equivalent is on a female patient. I don't know the name for that. Tighten down that a little bit and then buckle it in the appropriate buckle. And again, he's really not going to appreciate it if I yank on this strap, so push and pull at the same time to get the desired level of tightness. Is that okay? Alright, let's do the same thing over here on the left. That's all I need. I don't want the patient leaning so far that it's flexing the spine around. But now I'm going to floss.
Really nice. Because I have them like...
A little bit more flossing.
I made the group, you saw that?
Oh, no.
Alright, sir, you can center yourself. I pull the tension from behind the butt cheek. I wrap around uncomfortably close. I buckle. And I do a little push and pull. Alright. Now that's going to actually help lift the legs. If I'm lazy and have the legs way out here, it looks okay, but there's going to be so much slack that the legs will just flop around, and that's no good. So, bottom and the middle straps are tight. Leg straps are tight. Chest strap is still loose so the patient can breathe. Let's take a look at the head here. What I need to do is encourage my patient to sit up nice and tall and drop their head back so that hopefully it touches this device. Now you're all very young. You haven't had years and years of bad posture, sitting at a computer,
Video games.
You don't have a very kyphotic spine like my grandmother does. My grandmother cannot touch the back of one of these devices. If I put my grandmother in this, she would sit back and I'd say, all right, put your head back, and she would go. And that's it. But the device is going to be a full 6 inches from my grandmother's head. If that's the case, we can add a little padding in there. But don't add padding if it's not truly necessary, because a neutral spine is the goal. And if the spine can be neutral, we'd like it to be neutral. So I'm seeing here that with little to no padding, I like this picture, so I'm not going to add any extra padding on this patient. I don't think I need to fill this gap. Right? He looks a little like he's standing at attention, but I can live with that. In fact, you all are used to standing at attention, so that's what this will feel like. I'm going to just put this here and hold that in place. Same thing on this side. Alright, loving that. These might get a little crushed. So, well, I'll tell you what. We'll just be gentle, because you want those on. Two methods as well here. We need to secure the head. We have these WIMP straps, and I don't mind telling you that the WIMP straps, they're out there, but some people really frown on the WIMP straps, just because with the Velcro that is here, and they've tried to make it blood and germ resistant, but that also makes it really slippery. It just slips right off your head. So I think it's probably not the best. The idea with that would be to put this strap on the patient's forehead. And affix the Velcro, something like this. But as I said, I think that's probably too slippery. So I don't really like it. A method that works just fine is to use the same thing we do with a backboard, some nice medical tape. Same guidelines as before. We'd like to do some sort of tape that's going to hold the device where we want it and yet not remove the patient's entire eyebrows. Since the tape doesn't stick super well to the Velcro, it might pay to cross the tape in the back so that it holds itself down. If one strap gets it done, that's fine. I myself prefer to do that same chin strap that you saw Paul do. Be aware, if you've done a bad job here and you haven't gotten all the space out of the armpits, when you lift this device, this piece is going to shift upwards on the head, and it'll feel like you're trying to hang your patient. So make sure that space is gone. Alright, now that I've got the head secured, indeed the stabilizer can let go. So, let's take a look and double check ourselves here. We've stabilized the torso. We've got the head and the legs captured. Have I done everything that the skill sheet says? Am I ready to check the circulation, sensation, and motion?
Verbalize using
Indeed, indeed. My habit is to finish the job and check CSMs before I would move this patient to a longboard. So I'm going to go ahead and do that. Which toe, sir?
Big toe right.
Over here.
Big toe left.
Still warm? Can you gas pedal? Can you pull up? All right. And let's see here. Good feet or good radial pulses? Yes. Can you wiggle your fingers? Which finger is this? Which finger is this? Squeeze, squeeze. All right, that's good. I've checked my CSMs. Now we're ready to move the patient. Moving the patient, we're going to talk about this a lot, but come around here and this side actually. Moving the patient, depending on the automobile, it ends up just being, sir, give yourself a big hug. Grabbing these handles here, grabbing underneath a leg, and two people can lift the patient and move that patient to backboard. Oh, slide off. Don't fall. All right. Or we could put the backboard on here, rotate the patient and slide them on, but that's for another day. What I'd like to focus on right now is just learning how to put this backboard on. But indeed, for the test, it ends when you say, and I would move my patient onto a long backboard. And they'll say, all right, did you forget anything? And they say, I'm not sure, but I think I did everything. And they'll say, okay. Any questions on this short board?
He leaves all this on.
Great. Once we get the patient onto the board, then what we tend to do is loosen the straps, cut this tape, go back to manual stabilization. We need to undo the leg straps so that the legs will lay flat without constricting everything. And then we'll apply the backboard straps over the whole device, usually. So we just loosen everything and put the backboard straps over it. So it's too awkward to get this off without jostling the spine. So great question. Great question.